Hello everyone, I'm Roshani Abhimanyu. I have completed my Bachelor of Optometry from Lakshmi Institute, Panvel. Now currently I'm pursuing post-graduation diploma in contact lens dispensing from Indian Academy of Optometry. Now I'm going to demonstrate insertion and removal technique in soft contact lenses.
To maintain the hygiene before handling the contact lens, wash your hands neatly, including tip of the fingers and nails. So it will prevent the transfer of germs, bacteria and debris that could cause infection and irritation to the eye. Then dry your hands with the tissue paper or with the dry and clean cloth. Open the contact lens sachet from the given opening side and make contact lens out with the help of thumb and index finger. Put it on your palm of the opposite hand. Make sure your hand should be dry. To determine if soft contact lens is inside out before inserting it into the patient eye, we will check it with TACO test. Now, there are two methods involved in this TACO test. Method 1. Put the lens between palm lines and check whether the lens is curved inward or outward. Ideally, lens should be curved inward. Going for method 2. In this method, keep the contact lens on the tip of the index finger and check whether it is complete cup shape or the edges is out. It should be a complete cup shape. After finishing this method, now it's time to start the insertion procedure. Make sure the patient is comfortable first as you explain the procedure before inserting the contact lens. If patient is sensitive, you can give a target and ask patient to look at his thumb or towards his nose and place the lens according to the patient comfort. Once patient get comfortable, start with the procedure. Hold the upper lid margin with your thumb or you can use your index finger also while placing an open hand on the patient's forehead. This creates a support and allows the practitioner to have some control of patient's head. At the same time, hold the lower lid margin with your middle finger. While holding the upper and lower lid margin, make sure you have hold the eyelashes tightly to avoid touching the lens to the patient eyelashes, which could cause reflex blinking. By having the patient look away from the lens, which is introducing from the periphery, the patient will not be aware of the lens is coming towards the eye. Now insert the lens gently into the patient's eye. After inserting the contact lens, continue to hold the lids and have the patient slowly look about. While holding the lids, look for air bubbles underneath the lens surface. If air bubbles exist and the lid is closed quickly, the lens will buckle and displace. To avoid this, ask patient to move his eyes accordingly until the air bubble gets settled. After making sure this, release the lower lid slowly and then the upper lid and have the patient close the eyes. Now gently massage the upper lid to force out any air bubbles. Instruct the patient to close his eyes for a while until he gets adapt to the contact lens. After getting comfortable with the lens, ask the patient to open his eyes and move his eyes in all the gazes. Now, examine the lens position with the help of torchlight or you can also use slit lamp examination. In this examination, lens fit check should be done with lens centration, lens coverage, post blink movement and air bubbles. It shows if lens is ideal or not. After all the examination, we will move towards the removal procedure. The removal procedure should be easy and quickly. Now explain the removal procedure to the patient. Have the patient look upward direction. Place your index finger on the 6 o'clock position of contact lens and slide it down while holding the lens in a place with index finger. Quickly and lightly squeeze or you can pinch the lens between your thumb. Now remove the contact lens gently and make the patient comfortable. However, you have done with the insertion and removal technique of soft contact lens in the patient.